Hi, everyone. Hi, thank you for your patience as we are finalizing a few glitches and making sure that we can commence with the webinar and making sure everyone is here. Welcome to our Life Maps exhibition. We are very excited about our Life Maps exhibition. It's a special and unique activity and the result of a 3-year long journey in Malawi and South Africa. My colleague Gloria, can you please project our presentation so I can go quickly through the agenda and present our speakers today and the flow of the webinar today. My name is Jelena from ITPC Global, and yes, we are here today to talk about our exhibition, and we will present around the way to access it and 50 photos presenting 5 different topics from the life of our superheroes, our authors, 39 of them total in South Africa and Malawi. We will start briefly with our Watch What Matters lead, Krista Lauer, who will tell us more about the entire concept behind the life maps and also CLM and also generally ITPC work. And then we will give a word to our colleague Larissa, who is our communication specialist, who is also the original creator of the life maps concept, of the life maps idea, the founding mother, as I like to say, and she will give us more info about the genesis and development of the life maps concept. And then we will move into the practical implementation, and that is Ruby, who is sitting in Malawi, who is our life maps manager. She will tell us more about actual implementation in Malawi and South Africa, where she's working together with our colleague Kokelwa. And then the real deal, which is actual tour of the life maps, and we will give around 10 minutes. We won't go into details into every picture, every story, every narration, but we will give the flow. And our colleague Emmanuel, who is our tech wizard, has put a lot of effort into creating this virtual space, which will be alive for many years, and we will give you more details in that segment. And then after the tour, we will zoom in on 2 stories, one from Malawi, one from South Africa, where our participants, superheroes, authors, will give us more in-depth real life stories behind those pictures. After that, we will definitely try to leave time for Q&A, because this is a bit of a new concept. Also, if, be patient with us in case we have some glitches along the way, because the whole concept is new. It's not a typical presentation. It's an exhibition, but we are very happy to share about the methodology, as SOP, operational procedures of life maps, how we came about it, how it experienced from our panelists. So feel free to ask questions. Feel free to use Q&A box here in the webinar. We will try to answer as much as possible. If not, we will come back to you. You can always reach out to us after the webinar as well. And the closing remarks, we will give brief closing remarks and try to take a group photo, which is also important for our institutional memory. So thank you for willingness, who is willing to take photo, to put your camera on in the end. And we are very tight on time. We have only 50 minutes starting from now. So I would just like to also give a quick housekeeping rules and show the beautiful faces of our speakers. On the next slide, you will see our executive director, Solange, who is apologizing, cannot make it due to challenging traveling journey she had, so she will not make it today. But Krista is here. You all know Krista, most of you, from she's the lead for our
Alors, Krista est ici, comme vous le connaissez.
Focus area. Then myself, Jelena Bozinovski, and then Ruby, she's based in Malawi. Larissa, our comms specialist, based in Cape Town, and we have Emmanuel from Johannesburg. And of course, the most important, I would say, for the creation of the content today, we have two superheroes who are here, who will show their face during their sharing their stories. But here we wanted to symbolically show we do keep anonymity of our participants. So we give them the superhero status. We have Drax from Malawi and the Hulk from South Africa. They will be talking a bit later. And last from my end, housekeeping rules in 1 or 2 minutes. Please, you will be muted. If you want to unmute and speak for the Q&A session, please raise your hand. Use the chat to introduce yourself, which is already happening. Q&A, please use Q&A throughout the presentations. If any questions, if not, we will do that for the Q&A session. Don't worry, we will share the webinar recording. We are aware that is in Europe, at least Northern Hemisphere, is a holiday season, and we will share the recordings. And I know there's a lot of things happening. So who doesn't make it today, we will share for you to circulate with your colleagues. And lastly, we are intended to have this conversation in English with translation to Chichewa and French. So we are, as I see, having some technical problems in allocating a French translator. So please stay tuned. We will try to do that ASAP. And then you will see here on the interpretation kind of globe icon in the middle of the screen, Chichewa. So we do have a Chichewa translation, and when one Drax from Malawi will be talking, she will be talking in Chichewa. We should all then switch to the channel so we actually understand. Okay, I hope that is it from my end. My colleagues, if I miss something, please remind or put in the chat. Without further ado, I will hand over to my colleague Krista for the framing introductions, and welcome one more time and enjoy the exhibition tour. Thank you.
Thank you, Yelena. I'm here on behalf of our Executive Director, Solange Baptiste, who really wanted to be here today, and as Yelena said, is not able to for travel-related reasons. I'm going to keep my remarks very brief so we can get to the good stuff, the participants and the photos. I just wanted to say 3 things. Today's presentation is one of the most innovative we've ever had the privilege of doing. It's not a PowerPoint presentation. It's a real photo exhibit in a gallery. So I just wanted to briefly explain how Life Maps works, fits into our larger mission at ITPC. So this first slide is about community systems. ITPC is dedicated to improving health programs and health services through robust community engagement. I'm trying to slow down a bit for the translators. This infographic shows that community is at the heart of broader health systems, and this is why we place communities at the center of everything we do. Next slide, please. Many of you may already be familiar with community-led monitoring, and this is a photo of our community-led monitoring cycle at ITPC. It involves educating communities about the various science of different diseases, identifying gaps and pain points, creating indicators, recurring data collection, analyzing key themes, and advocating for change. And how Life Maps and the photos and narratives you'll see today fit into CLM is really about data visualization. So CLM typically includes quantitative data, things like the average wait time at clinics, whereas Life Maps includes photos and narratives as data visualization, not just charts and graphs. So we think this is part of telling the whole data story. Next slide, please. And to explain the broader context, the Life Maps project is happening in the context of our citizen science project. So you can see this has been a 3-year effort. We're monitoring in 2 districts in Malawi and 1 in South Africa. We have a mix of quantitative and qualitative data, and Life Maps is allowing us to triangulate findings from the CLM program, and it often showcases the broader context underlying health outcomes. So with that, I will pass along to my colleagues. Thanks so much for being here today. We're excited to share the work.
Krista, I think I'm the next person on that list. So I'll just be introducing everybody to where the project started. And I'd like you all to try and remember how complicated it was to do things during the height of the COVID pandemic. So the Life Life Maps project was started towards the end of 2020, and the original citizen science budget allocated some money for focus group discussions, but it was impossible to have focus group discussions because we couldn't travel and we weren't allowed to meet in groups, either large or small. So we needed to really brainstorm to come up with ways to ensure that the voices of recipients of care were amplified in the project without putting anybody at risk. So with the help of Emmanuel Simon, who's with us today, qualitative research expert Dr. Rebecca Hodis and I brainstormed ways to collect the data safely. And in January of 2021, we recruited Ruby in Malawi, and that's how the Life Maps project was born. We recruited 10 participants in South Africa and 10 participants in Malawi. We provided them with mobile phones and with PPE and with data for their mobile phones. And then we trained them on how to document their lives, how to take photos, how to take video, how to record audio messages, and also things like how to ensure the anonymity of the subjects of their videos and photos. So to not take photographs of children, to not take photographs of people in healthcare settings, to anonymize submissions as far as possible. But that, over the course of the last 3 years, has provided us with an insight into the lives of recipients of care on the ground during the height of the COVID pandemic and as the health systems have recovered. So we used Telegram, which again was a suggestion of Emmanuel, to have people submit their photos and video as a way of, again, ensuring as much security as possible for the submissions. And by the end of 2021, we had thousands of photos and videos, and we really had a good snapshot of how health systems were starting to recover. So I'm incredibly excited to see this exhibition. I think Ruby and Kokalwa and the Life Maps team have taken the project and run with it and grown it to such an extent. And I think it's become an incredibly valuable component of the whole project. So over to you, Ruby, to take us through the last 3 years of the project.
Hi, everyone. Hi, everyone. My name is Ruby, and I'm sitting here in Malawi. I'm the Life Maps manager, and I'll give you a brief overview of the Citizen Science Life Maps project. So like my colleagues have echoed, this project is a multinational project that is happening in 2 countries, Malawi and South Africa, mainly in 3 districts. 1 district in South Africa, which is the Western District, and 2 districts in Malawi, which is Dedza and Kasungu. This was done deliberately to happen in these places for data triangulation, because these are the same districts where CLM is also being conducted. So we want to triangulate our data that we have been collecting for close to 4 years, 3 years in the making, and 1 year of pilot with CLM data. And we have, as we stand now, we have got 38 participants that we have. We started with 40 in 2022, but we lost 2 along the way, and we currently have 38. Our participants are recipients of care who are receiving services in various healthy facilities within South Africa and Malawi. And these people are our data collectors, our recipients of care, who document on their own the challenges that they face in accessing services, mainly HIV services, and also other challenges that they face in their facilities. And it's quite an interesting project, as we have said, because they collect data of various forms, not only the traditional data that you know in text form, but they also collect data in forms of photos and videos and even voice notes, and those are translated in its own totality. So we've got immense data that we have collected for over a period of 4 years, and we have been analyzing it in bits and pieces. Like I've said, these are recipients of care are given an opportunity to document their own lives. They are called citizen journalists. No, it's not like the traditional way of data collection that we are so used to. This type of study, the life maps, we give our recipients of care, our participants, a chance to document on their own the challenges that they are facing. And in this form, they are part of the project. We can call it it's participatory in nature. And we have been running this project for 3 years. It started in 2022 and it's ending in 2024. But we also did a pilot, like Larissa had mentioned, in 2021. And we've got various themes that we have explored so far. Over the year, or over the period of 3 years, 4 years plus, we have explored more than 20 plus themes. For each and every month we have a specific theme that we explore with our participants, and we give them different themes every other month. So one of the themes that we have explored is like mental health, water and sanitation, the impact of COVID-19 on HIV services, and so many of them. So as we go along, you'll hear more about our participants and the photos that they have collected. But this is an overview of the Citizen Science Life Map project, and I'm excited that you're all here, and let's watch along what we have to offer you. Thank you.
Thank you, Ruby. This is Krista again. I'm just stepping in briefly. I understand we're having some challenges with translation, and that if you are clicking on the interpretation icon at the bottom of your screen, you may not be hearing French or Chichewa. Je comprends que peut-être la traduction ne marche pas en ce moment. Si vous êtes en train d'essayer d'appuyer sur l'icône du globe dans la vidéo, nous sommes très, très désolés. On va travailler là-dessus. So we will continue to work on the translation and we will keep you posted on our efforts. So without any further ado, let me now hand back to the agenda. Actually, Ruby, do you mind to just sort of repeat what I said in Chichewa, just to let those know who might be waiting for the Chichewa translation that we're experiencing technical difficulties? Thanks.
Yes, sure. Takulandirani nonse ku mkumano wathu wa lero. Pepani kwambiri chifukwa chonena kuti timayenera kuti tikhale ndi munthu wokuti aziyankhula muchichewa, makamaka tikawira pa batani limene lilipo la interpretation kutabwanyanso pamene pali chichewa, timayenera kuti tidzimva muchichewa, koma chifukwa choti pali zovuta zina sitikutha kutero, koma tiyesetsa kunena kuti tikhonze vutolo kunena kuti muzithanso kumva bwino muchichewa. Zikomo kwambiri.
Thank you very much, Ruby. Thank you very much, Krista, for stepping in this flexibility in the virtual world we always need. But speaking of the virtual world, we are now come to I would say, the most exciting part of this presentation. This all belongs to the introduction. You heard about the ITPC CLM framework, the whole position of the CLM in community system strengthening. You heard about the genesis development of the life maps concept, and from Ruby about more practical steps of implementing. And now we have been collecting data, like I said, for 3 years. This is the kind of the qualitative side to the quantitative side that we offer much more focus on. So we would now like to go to show that one picture can show more than 1,000 words, as we said in our invitation. And I will hand over to Emmanuel, who will guide us through the world of the exhibition, and will show us how to navigate, because after this webinar you will all get the link to the exhibition. So we will not technically be able to go through all 50 pictures today, but you will see the structure and you will see how to access it. Then you will go and you can explore and go through every picture, every explanation, which is in English and Chichewa. And you will be able to see more, read more about the life maps story on the website as well. So over to you, Emmanuel, and thank you.
Awesome, terrific, excellent. Hello, everyone. I am honored to present to you all a very unique exhibition of the life maps photos. And what I'll be taking you through for the next 5 to 10 minutes is simply going to be how to navigate the site. It should be available and should work on your mobile, on your tablets, on your large screen devices. I think the one thing I'll share about it was when we thought about how we wanted to represent this, obviously the idea of renting a space, a physical space, and putting the pictures up was top of mind. But obviously the limitations of only having the people who were physically there to see that was something that we wanted to move beyond. So the conversations moved into, well, we can do a photo gallery online. Everybody knows how to do that. But we had an opportunity to do something really different. And hopefully you will sense both the excitement and the way that we've tried to really honor the work and the representation of life and lived experiences that the LifeMaps participants delivered over this time of this project. So with that, I will jump into. So once you get your link that will be provided later, you're going to end up at this website. And this is part of the Citizen Science website, where you can see we have a new gallery page. And you can think of this as your front door to the exhibits. We have 5 exhibits. They're listed here: mental health, stigma, and discrimination. Oh, the screen. COVID-19 and the impact of poor water and sanitation, the impact of COVID-19 on treatment access, my COVID-19 diary, and the economic impact of COVID-19. So right now we have begun with 5 exhibits, 5 exhibitions. For each of these, you'll see there's a slight short description on what's inside. I keep scrolling on the wrong screen. But once you're ready to enter any of the rooms, you'll just go ahead, click the button, enter the exhibit. So you can always use this page to go in between the rooms, but I'll also show you, once you're inside, how to maneuver from one room to the other. So while the platform loads, you should expect to get a loading screen. Typically, this should work across all browsers. If you do have a problem, we've seen 1 or 2 cases where you didn't get the enter button, which we just saw appear here in that event. I would say either restart or maybe try a different browser. But in all the cases where we've seen an issue, by changing a browser or restarting their browser, it's been resolved. Welcome to our first room in the exhibit. So as you can see here, we have a real-life virtual representation of a gallery, the space, and all of the photos in it. You'll see a little guide on the right to help you navigate it. So you can use your mouse to draw, to scroll and move around. And it will help zoom in and position to each image, starting in the order. You can also use your keyboards to move further away, move closer in, and also to navigate panning side by side. All right, so you can imagine this is a really great way to dig in, look really closely at the images, at the exhibits. I mean, when you kind of get to close enough speed, it almost puts you in the middle of the experience, in the middle of the action. And alongside every photo, there is a description outlining not only what's happening in the image, but also their account. So it's not purely descriptive, but a lot of the narrative, a lot of the thought also relayed in it. I'm not quite sure why this one isn't showing the. Right, so if you can see, I'm using my keyboard right now. So up, down, left, right, you see them also here. And that allows me to pan around the room. Each room has 10 images from different stages around each of those topics. And for each of the images, let's take a look at this one here. So you can click on an image and it will auto bring it to front and focus for you. As part of the description, you will see that the descriptions are given in English and in Chichewa. In some cases where you have really long descriptions, it will not all fit here. So I will show you how to access those. It's right up here in the top where they have opening, and you can scroll through the full details in all of the text that was provided. All right. If you have any questions while I'm going through this, please use the chat, use the Q&A section so we can cover them after. All right. For every image, you have the description, you have the image, and you let us know which ones really stand out to you, which ones you really like. And if you want to share these, you can do that from there, right? I believe the sharing will allow you to send it across most of the social media networks. So you can just click one, it will format it, create the link, and allow you to easily share that. All right. Excellent. Why don't we take a look at another room, right? So this is the first room. Let me pan around one more time. All right, we have a description on each topic that will be located near the first photo. All right. Now, the only other thing that I definitely wanted to show you is how to move from one exhibit room to another exhibit room without having to go back to the first website, which is obviously an option. You can always come back here and click on enter the exhibit. But there is a way to move from room to room from within, which is to use this menu here that says more exhibitions. So you can click that and all of the rest of the current exhibitions will be listed and we can go to that. So I think the second one, we can look, it will show, so there are 5 in all. So you will see the remaining 4 listed here. Let's take a look at the poor water and sanitation one next. It will again go through the same process of reloading the exhibit space. And once that has been loaded, you will get the entrance, the enter button, the sign to go on in. Excellent. Yeah. And here we are in the second room on water and sanitation as expressed. All right. If these silhouettes of people are in your way and you don't like that, you can turn them off by simply turning off people here. All right. So same thing here, looking around the room, spend some time. Photos have been in many cases. We've tried to present them in near real size so that you can not only get a sense of what this feels like, but also get into the details and experience that. Excellent. Right. All of these have a story. So the pictures are amazing by themselves, but I think seeing the stories alongside really add a whole new dimension to appreciating it. All right, I think that is really all to it. Like I said, we aim to make it simple, easy to get around, easy to navigate, easy to experience. You can go full screen. So my invitation to you is to try it out on your phone, on your computer. Obviously, the bigger the screen, the more immersive. I think you'll probably enjoy it a lot more. But let us know which ones are your favorite pictures by liking them, sending any comments, and keep your eyes on the space as we have a lot more than just these 5 areas. So we'll hopefully be releasing more over time. So I think that is it from my side. So
good day, everybody. Oh, sorry, Mario. All right. Good day, everybody. My name is Kokelo Zokwana, and I'm seated in the West Rand, South Africa. And I am proud to introduce a participant of mine that's been with me since the year 2022. And with that, I think their story is based formally around how they dealt with mental health around this year. And I'm proud to introduce the how as a pseudonym, and he'll introduce himself by name. Thank you.
Good day, everyone. My name is Joseph Malafani Meeting. I'm from South Africa, West Rand, from Wataneza Community Care. I'm a life participant from 2020. It's been 23 years this year. I'm here to tell you about my story of how mental health started to affect me since after high school, because of when COVID started, I was still at school because it was my first year at tertiary. That was my first at tertiary. And by that time, I didn't know many things because of now. I took everything light because I was still a young boy and a young man by that time. So when people told us about COVID, that okay, there will be a lockdown, a cave in South Africa, I took it light by that time because of I never thought of COVID. I thought it was an international thing whereby that thing affected people outside South Africa, because of also as a religious man, we didn't think much about how COVID will affect me and how everything will affect me. And whereby by that time, I was still in high school, going to school. I didn't think much of it because of my mindset was all about schooling. So when the president started to introduce that, okay, we need to stay at home, the cave is there, whereby we start to see the South African National Defence Force coming to guard us to make sure that we are at home, we're following every lockdown precautions, that we are wearing masks, we are doing social distance. That's when now I started getting affected because of I was not used to stay home by that time, whereby I started to drink alcohol by that time because of I was not going to school, whereby I'm affected by it. Because by that time I was going to school because of a buzzer, whereby I couldn't even go to make amendments to say, okay, can I go to school again? Whereby I needed to stay at home for a long time. Even today, that is still affecting me. So my journey throughout, I was affected by that only, whereby I couldn't go to school, I couldn't study. Every time we see soldiers coming to our locations to guard us, some people, they have been beaten by soldiers, some people have been beaten by police officers. And now, us as young people, we are drinking alcohol most of our time in the lockdown. We're not even following precautions, and it's hard for us to even access medication at clinics because of some clinics were closed by that time. You were required to be vaccinated, you were required to be wearing a mask, to do social distances. And now the prices of food and everything was going up because of now it was scarce for people to go to town again. Even the taxi, everything was scarce to be done. And by that time, I was young. I didn't think much. So during that journey, going forward, okay, we started going to life maps, whereby I started to be a participant in life maps, starting to know about many things. Even when I started to do life maps, I met, it was a woman called Mehopani, who was HIV positive by that time, who was taking these pills, who defaulted by that time, who told me that, okay, I defaulted because of I didn't take pills. I asked her, why didn't you take pills? She said, I'm affected by food because of it's scarce for us to get food in the location. Food security was affecting her. Even me, by the time it was affecting me. So I asked her, how does she manage to get food during this time? She said, no, I get food because of a social grant, which is less also, and I'm defaulting by that time. So unfortunately, she died because of she couldn't manage and she couldn't drink pills on time. Again, she was defaulting most of the time. I asked her how she got infected by HIV. She said before 2010, she was raped by a guy who she didn't know. And she didn't know that she would be HIV positive. And now she had to support kids by that time. That's why on the picture, there's a picture where you see pills. Those were pills whereby she was affected by TB and HIV. So during that time, and my mental health was very bad. So I had to learn from her situation to say, no, her situation can be my situation because she's a member of the community, whereby I also was affected by someone who was HIV positive, my father, during COVID, close to December by that year, I still remember, whereby I was visiting my mom. I got a call from my stepmom where she told me that, no, you need to come back home because of now your father is sick and she doesn't want to eat food. She doesn't want to take anything from anyone. The only person who can talk to him, who can make him eat food, it's you. Okay, came to home. I had to make sure that, okay, my father gets everything during that COVID lockdown, because he wanted food by the time. He wanted like make sure that food is there, and by that time we were depending on 350, and it was the first year they introduced 350 SASA grant. Yeah, that was the first year, I still remember. So by that time, my father is a religious person who believed in traditional leaders. Traditional leaders told him that he ate the potion by that time, and he was getting sick, very ill, and he was coughing. So I once told him that let's go to a clinic and test, because I was also scared that maybe he's infected by COVID. And then he didn't listen to me sometimes, so I had to drink alcohol. Always when I was affected by mental health, I was drinking alcohol. So I went to him, we went to the clinic. When we got to the clinic, they told him that, okay, so you are HIV positive. You need to start to learn from this point that, okay, you're HIV positive and you're TB. So all this time, he seated there. So we started taking pills from that point. When I started taking pills, so that's why I started to learn about HIV, how it affects me. I asked him, how did he get HIV? He didn't tell me his story, and that is true. So going forward, knowing that, okay, I have to take care of him. Taking care of him took me like 3 months, and I couldn't go to school again. I was studying. Another time it's lockdown. Access to medication was scarce. Going to the clinic, I went on times. Like it was very, very scarce. So sometimes I would go to its pharmacies here, try to buy some other stuff to make sure that, okay, he gets everything. So after the situation, okay, when he started to heal, that's why, okay, COVID started to stop a bit. When COVID started to reduce, okay, we were told to get vaccinated. Okay, I got vaccinated to make sure that, okay, I can get my father everything that he needs by that time. Okay, so to make sure that he gets everything he needs. So going forward, I made sure, okay, I needed to start to learn that I need to reduce my mental health issues, try to go to school, but it affected me because of it was hard to go back to school because of now NSFAS has its own limitation to say if you failed or if you had reduced your marks, you cannot go further, you cannot go do this, and then it still affects me because of I cannot go to school because of the thank you for your time. Thanks. I'm done. Thanks.
Go ahead, Ruby.
Hello, everyone. Ruby again. So I'm here to introduce my participant from Malawi, specifically Deza, that's drugs. So she'll give you her side of the story. Thank you very much.
Hi, everyone. I'm Christina Gancheche. One of Life Map participants, and also one of people living with HIV here in Malawi. I joined the ITPC 2022, where we trained how to take pictures, how to make good videos, how to make voice notes, and so on. So we get stories, like we get films where we make stories, we share stories. I like sharing stories, yeah. Some of the theme we got is stigma and discrimination, attitude of health workers, viral load, rape, mental health, and water and sanitation. Here, as you can see, that is my pic I sent to share my story, my community, where they get water. This is the place where people fetching water for domestic purpose. So, as you can see, it's not running water, so that people can easily get diarrhea and cholera. It affects me so much, because in the other side I am living with HIV and AIDS. In other side, poor water like this, as you can see. In our community, there is problem of water. people, they don't know how to treat water. They just go and fetch water and go for domestic purpose to do drinking and so on. Yes.
Christina, would you like to speak in Chichewa and then Ruby can translate for you?
Okay. Amene mukuoneramu apa ndi malo amene timamwa madzi mudzi wathu wonse umene uli ndi mabanja okwanira 300. Ya nde anthu amangoona kuti madzi akamwa kuti alibe madzi enieni aukhondo okhazikika, koma amangoona kuti basi pena paliponse atha kumwa kaya padzithawale kaya pati atha kugwiritsa ntchito. Ndiye mmene mukuoneramu madziwo sioyenda ndoti atha kudwala kolera, kutsegula mimba ngakhalenso fiva. Chifukwa chati dzilombo lopezeka madziwo, chifukwa madziwo ndi ongokhala sayendayi. Mmene mukuoneramu amanena kuti madzi ndi moyo, water is life, but is this life? Is this water for life? I don't think so. Thank you.
Let me also translate in Chichewa what she said. So that is a big icho ndi chithunzi cha Christina chimene iye anatenga nthawi imene amapanga assignment ya water and sanitation. Amafuna kuonetsera kunena kuti madzi ndi ovuta kuti angathe kutenga mumudzi mwawo. Samakhala ndi madzi amene amakhala apampopi amene amapanga run ngati amene timamwa anthu ena afe. Koma madzi amene amakhala nawo ndi madzi amenewo amene mukuwaona pa chithunzipo. Ndiye ndi zinthu zovuta kwambiri ngati iyeyo munthu amene ali ndi matenda a HIV and AIDS komanso madzi amapezeka kunena kuti akutunga pamenepopo. Zimapangitsa kunena kuti akhoza kukhala pa chiopsezo chodwala matenda ena monga matenda a diarrhea komanso kolera. Ndiye chithunzi chimenecho chimasonyeza assignment imene anapatsidwa makamaka ya water and sanitation kufuna kuonetsera kuti madzi amene amakhala nawo nthawi imeneyi ndi madzi onena kuti si abwinoyi. Yeah, thank you very much.
Thank you very much, Ruby. Are you done with your with Christina's and Drex's presentation, right?
Yes.
Okay. Okay, thank you all. We are also mindful of the time, but we want space to our superheroes and our authors to zoom in on specific stories. So thank you for that. And again, apologies for the challenges in translation, but as you know, it's also very hard in Malawi with internet access. So we're doing our best on that front. And so yeah, we do have for Q&A session. I see many questions related to the life maps on the Q&A box, but we will open the floor if anyone would like to, feel free to raise your hand and speak up and share any comments or ask a question to our panelists or ITPC team members. So I do see Molebogeng, is it from Botswana, has their hand up. So we'll ask if there's any question you would like to ask. Molebogeng, over to you.
Afternoon, everyone, and thank you so much for the opportunity to ask a question. My question is just to the Life Maps team, if they can just also enlighten us into how the process was with capturing these moments and going through these different themes on a month to month, and what do they see or envision going forward with the program. Whether or not it's coming to an end is another question, but what do they think they can do with this data in terms of taking it forward to like a broader audience and so forth? Thank you so much.
I'm sorry, I was muted. Thank you much for a very clear question. Let me just ask Mfo as well to ask a question, and then we will respond to this because the question might be grouped. Thank you. Mfo, over to you.
Thank you very much. Am I audible? Oh, okay. I just wanted to ask one of the live participants, the Hulk, in terms of the influences that he had to his academics. So I wanted to find out from him, with the experience that he's had, is there a chance for him to like move on with his academics, or was that like a dead end? And how that mental health affected that reality of his life. And then to the whole Life Maps team, I also just wanted to find out from them how these documentations, how are they now going to be used in terms of advocating for the different challenges that they have been able to pick up from the different people and from the different areas they were from. Thank you very much.
Very much, Mfo. Okay, so one question is for participant, one is from the team. Okay, let me see if any more hands. If not, we will start answering because again, mindful of the time, we don't have much time, but please feel free to type your questions in the Q&A box, and then we will maybe even faster answer or respond after the webinar. So let me hand over to my Ruby or Larissa, who would like to take the question of the from Molebogang, the way we are envisioning the usage of the data from the life maps, so maybe way forward. And yeah, the practical side. And that's also kind of related to the question on the advocacy use of data and maybe what's happening in Malawi. Maybe Ruby, you can share on the, using the data for the CCM. And then we will hand over to participant, maybe Joseph or Christina. Over to you, Ruby.
Okay, thank you very much for that question. We have been trying to get this data into the public domain. We have analyzed it. We do biannual reports, and we also have annual reports that are internal. So we have been producing reports for over the past 3 years. And we are currently writing a journal article about this project, whereby we are going to explain the methodology that we have used, and then we'll put out the data that we have analyzed and the results that are there. So we are trying much efforts to get our data into the public domain, one, through the journal article that is in the process of being published soon. And also we got a chance to write an abstract through the AIDS 2024, and we got a chance to, our abstract got accepted. We wrote 2 abstracts currently now, so we'll also present at AIDS 2024. And we have also been working with our CLM implementers, both in Malawi and South Africa, so that we can be showcasing our data, so that we can use it for advocacy. For example, I'm one of the CCG members here in Malawi at the national level, and I attend almost every meetings there, so that we present the data that is there, and then the data can be used for change and advocacy. So those are the efforts that we are currently doing, and we intend to do even more in future, so that we get our data outside there, so that other people can see it and even implicate what we are doing both in Malawi and South Africa out there. And then just also mention that we are also currently in a process of writing a manual, a standard operating procedure for the Life Maps project, which is also going to be out there for people to use as well, and duplicate even in
in Argentina, you never know. So thank you.
Thank you, Ruby. Larissa, would you like to add on to Ruby's response?
Sure, just very briefly to say that we are using the data gathered from the Life Maps participants to triangulate other data that we've collected directly from healthcare workers and in health facilities, as well as operational research that was conducted. And what we've done is we've used that to amplify particular advocacy messages. And that information has been fed back into district AIDS councils, provincial AIDS councils in South Africa, and to the National AIDS Council in Malawi via Manarela, our partner there, and via Nakosa, our partner in South Africa. And the idea is very much to not just collect the data and sit on it, but to make sure that the data is shared in real time to make improvements in the healthcare systems. And we've published recently a report, which we internally call the Triple I report, but is around 10 important impact stories that really explain how the project has been successful in creating change in real time. And we cite 10 key examples. So please check that out on our website. You can also find all the citizen science and life maps reports on our website, itpc.org, under the resource section. Thanks.
Super. Thank you for connecting the dots, Larissa. That's really very useful. And now, again, mindful of the time, we will give a hand to our colleague, participant, superhero author, Joseph, or also known as the Hulk, to address the question from Fo on the mental health issues. So Joseph, if you are there, please unmute yourself, and if you can respond to that question.
Okay, no stress. Oh, my experience is okay. When I started on Life Maps, that's when like things started to be simple, whereby I would speak about myself, meaning I would advocate. And then there was a time where they give us shirts whereby they spoke about activism. That's why I started to accept that, okay, mental health is an issue, but I cannot blame myself. I need to learn from learn from my mistakes, whereby I started to accept that, okay, it's fine, I can change. From there, started going to gym, trying to reduce stress and other stuff. That's how I reduced my mental health issues. Started to reduce drinking alcohol. That's the other thing. Started to reduce spending time with many people. Like now I spend time like at home. Starting to spend time with my parents. That's the other thing, how I reduced my mental health. And then the other way, there's a person who helped me to reduce my mental health issue. It was May Caroline from Otangan as a community care. Like spending time with her, like spending time with people who have like issues that are similar to yours. People who went through like from this situation that you were at, like explaining to you, okay, how did they overcome their challenges? Like that's how I learned, whereby I would sit with people who are older than me who explain to me, okay, this is what, and this is how you can tackle this, and you must accept that it's not the end of the world, that you can do more. Everyone has a potential. So what you have to do is to express that potential. Don't let mental health issues to overcome you. They are just an obstacle in life that you need to learn from them. And thanks for the question.
Thank you very much. Thank you very much, Joseph, for the to the point response. So we do have only 1 or 2 minutes left. So I would like everyone, if you are in agreement for us to take a group photo, to please accept Gloria's request to be a panelist. So we'll give 1 minute for that, so we can take at least, critical number of people. So we have the memory of this webinar. And again, if you felt like you did not understand a lot of content because of our technical glitches and translational challenges, please do let me know, and we will either try to organize another session, maybe just purely in Chichewa, or just in French, or just in Spanish, or just in Russian. I mean, we are open for spreading the word of the life maps as much as possible, because there are similar initiatives from USAID. I think has the journey maps, which are focused on the service provider journey, capturing the journey, but life maps are unique because we are focused on the recipients of care. We are focused on the communities. So it's actually very complementary, and we are very kind of proud of that approach because it's telling the full story. And like Larissa was saying, triangulating the data, not just from one angle, but from different angle, which is quite often, you know, the way to tell a full story. There's not always, the truth is always in the middle, not from one angle. Yes, please let us know. If you understood part of this, we are open for that. And I would like to thank everyone for being part of this exercise today. Like I said, it was our first time that we do present virtual exhibition online. We have shared the link to access our exhibition. So please feel free to explore, to share with your communities. Someone is asking, is it possible to make a documentary highlights findings of the CLM project experience? Yes, we do have a lot of documents. Please reach out to us with the highlights of success stories, of actually lessons learned, so we can, and we're open of sharing that, not just from ITPC end, but also other partners. Yeah, we would like to thank you all for being here today. Let us see if you do have a critical number of people for our picture. I think the screen is slowly populating. So
Can we ask people to turn their cameras on so we can see everyone's lovely faces?
Yes. Okay, Pragashi says she did not receive it. The request, yes, Gloria only has 2 hands. So it is a bit of a, yes, you see, slowly we are getting there, seeing all the beautiful faces. Thank you, Fidel, Yanko, Jane.
Yelena, as people are joining, can I just give a quick shout out to Jane Harries, who's been such a big driver in the project as well, helping us analyze things. And Jane has worked closely with Ruby and Kokawa to put together a journal article, which will be available, and we will make sure to share that on our website as soon as it's available. Also, a big shout out to Marita, and I saw Melikaya earlier, and to Harold and Yanko. But like, they have been such a big part of this project, from Manarela and Nakosa. Great to see you guys.
Yes.
Thanks, Larissa.
Yes, thank you so much, Larissa. It's always hard to appreciate everyone because it's a very, very much teamwork. So let us put our best smiles on and take a picture. Okay, I will try to do it. Larissa, if you can do it as well, and then also our Gloria. So let us all say superheroes. Okay, perfect. Thank you so much. I'm also aware we are 4 minutes past time. So again, thank you, merci, zikomo kwambiri. Thank you, everyone. We will share